Wanted to come on here. I'm Nina Hart. If you don't know me, I am a nurse and a nurse consultant, and I have worked for myself in a consulting role for about 2 years now. Um, I just thought it'd be cool. I'm working on so many cool projects right now, and I've had the opportunity to do some really exciting things that I've never done before. And I thought it would be great to share with you nurses what the opportunities for consulting are out there, things that maybe you hadn't considered. And then also, if you work for an organization and you're like, I need help with some things that I don't have an employee to do, that you would know how I can help you. So I thought that that'd be kind of helpful for everybody. So some of my active projects that I'm working on right now, some of the opportunities that are out there that I've had, or that I'm these are my active contracts right now. So I have a facility assessment for operations, so staffing to see what staffing they need, what the cost is going to be, how to best manage their labor. I have an adult daycare startup plan. I'm doing a CON response request. A CON is a certificate of need. So someone has requested one, and we're crafting a response to that request based on the utilization of the area. And then I'm doing another certificate of need application to help an organization who wants to get a certificate of need to add services in their state. I have two active home care to home health licensure applications. So they're an existing home care, like a private do medical home care, and they want to add home health services. So we're adding that licensure. I have a QAPI chart audit. So monthly we do hospice audits on their charts, and then we put together a report about what we found in the charts. So we put together a brief summary. It's just a couple pages, like, hey, here's what we found in the charts. Here's how you could correct or improve that if that's a concern. And then we're also going to help them compile that into their quarterly QAPI meeting, so that that really takes the work off the QAPI team and off that leader to do that QAPI. So that has been an amazing project. I'm really enjoying that. And I also have hospice experts who are subcontracting with me to help me do those audits because I can't do all this alone. So it's great to be able to help support those experts who have worked with me for the last 10 years and give them opportunities. So I've got help. And then I'm creating a surveyor guide for a hospice software program, and other compliance tools for surveyors. So there's a hospice EMR, and their goal is to make sure that it's the most user-friendly, most compliant EMR out there. And so I have created some tools and some graphics and essentially a user guide for surveyors when they come in. Since it's a brand new software, there's not many with experience with it. And then I'm also writing policies and procedures for a home health and a palliative care program. So that's exciting. So that's a lot of detail work to make sure that they have everything in their policies and procedures that they need, that they're going to be compliant, that they're going to have a good survey, and that they're going to get approved to open. And then I'm also working on an EMR transition project. So a company wants to change EMRs and they need some help making sure that's successful. The projects I have pending right now are really exciting. So education and orientation training, another policy and procedures project for a hospice and a palliative care. One that I'm really excited about is an expert on call bank. So this is a way for small hospices or home care or home health or even nursing facilities who don't have a regional, because they're a small, maybe one location hospice agency, and they need some help with compliance. And they're like, we don't really have anyone we can call. So I've created a bank where they can deposit hours and have an expert available. So they have unlimited email, and then they have hours for projects that they can use out of that bank, and they can refill it as much as they want to. So I'm really excited about that. I think that's going to be super helpful for these smaller agencies that just can't pay a consultant or can't pay for a monthly service because they haven't even broken even themselves yet, but they still need those resources. I'm doing some leadership compliance workshops for hospice, and fraud prevention type of education because of everything that's going on in the media right now for hospice. There's a lot of attention on that. So I'm creating some workshops for some hospice agency leaders to make sure that their staff understand compliance, understand fraud, and know how to prevent that. And then I'm also doing a labor assessment and plan for a hospice. So those are some of the projects that I've been working on. I'm working on right now. That's a lot of exciting stuff. And there are so many more opportunities for nurses out there. So if you're wanting to get into consulting or you feel like um, you are not really sure what you would do, those are some ideas. Those are not things I've had tons of experience doing. So a lot of the times we talk about being an expert, and sometimes it's just learning new things. I'm really transparent with my clients or potential clients about what I have done and my knowledge base of what I can do and how I can support them. And then we work together. We set a budget, we set a goal, and we collaborate on the outcome. So everybody learns, everybody grows, and they get what they need. So it's really exciting to be able to do those things. Um, the other ideas for consulting needs that I see that are not a strength for me is billing. So I fully am transparent with clients that I'm not a billing expert. I don't do billing. So if you're a billing or reimbursement specialist, OASIS, MDS, those are real needs in the post-acute community for consulting. They need people who have done that, people who can train other people, who can create tools and orientation, education, and safety is huge right now, and emergency disaster preparedness. There's a lot of opportunity there for education, for plans, for tools. Value-based care. Value-based care is the hot thing right now, right? So if you know about value-based care or it's something you've done or are learning about, start sharing that stuff because there's going to be a huge need for consulting expertise on value-based care and support in that area. Marketing and sales is always a big one. If you have any marketing and sales experience as a clinician, there are so many tools that you can use to help support organizations in that way. And then clinical education programs right now, there is an endless opportunity for subscriptions, for more digestible content for clinicians to be able to take and apply to practice. That's one thing I really see is with TikTok and all these short bursts, there's really an opportunity to create different education platforms that clinicians can really use. Unfortunately, the orientation programs that I've taken as a clinician were not engaging or digestible. It was really laborious, time consuming, dull content, and we can do better. So that's something as far as the fraud and compliance piece of it that I'm really trying to do is have live, engaging education on that and share examples that I've seen of fines that were given or nurses that were arrested or administrators that whose license were pursued because they were unintentionally doing something fraudulent or intentionally. So that's the kind of content that we need to have that we can really actually use for education. There's always a need for those orientation programs, but it needs to be more than just orientation and annually. And then anything that you can do to meet a need and take over and add. So a full-time employee can't do the things I'm doing. They have their full-time job. They have their hours they have to meet. They have their tasks they have to do. They don't have room to take on this type of project. So if you're a nurse and you're like, I want to be a consultant, but they keep trying to hire me, or why can't they just hire a full-time employee to do that? Because there's not a full-time employee that can do that, right? Um, if a full-time employee could do it, it would already be done because they have tons of full-time employees, right? So these are specialized projects that they don't need someone to do ongoing. So if you're wanting to get into consulting, look at services that can add to what the organization currently does. Look at things that can take over existing needs, that can take the workload off of clinicians, that can take the workload off of the leaders, that can improve the outcomes of the patients, and that are specific. specific to something you could implement or provide that they can continue doing, or a subscription service where you provide a certain service or education that can help the organization by them not having to provide that, right? They don't have the labor or um, the FTEs to provide that service ongoing. So it can take the place of something they already have. So I hope that was helpful. I hope that wasn't overwhelming and gave you a ton of ideas about the needs for nurse consulting. All of those projects that I listed are things I am currently doing to help clients. Already been paid to do. So the need is there. So if you feel like there's not something that you could offer, try and take a different perspective, because these are all things that I'm currently doing, some of them that I've never done before, that I'm working with clients on a specific need that they have. So sometimes just being open to listening to what the organization really needs, and how you can meet it, is the most helpful. So I hope that gave you a ton of ideas. I would love to collaborate with you. Send me a message if you have a need for a project. I would love to help you. Or if you're looking for consulting opportunities and you need some support or connections, please let me know how I can help you. So thanks again. And I hope that was encouraging and helpful.